everyone, my name is Borsky and I'll be talking about the influence of anesthesia on harvesting the semitendinosus tendon for ACL replacement. Aim of our investigations was to look at whether the type of anesthesia is a relevant factor influencing the length of the semitendinosus tendon harvested for ACL reconstruction. The idea was that if we can harvest a longer tendon, there is a better chance of being able to quadruple the graft rather than just triple it. And this would then in turn yield a higher diameter and therefore a stronger ACL replacement. ACL injury can result in significant functional impairments, and this is a reason why ACL is the most commonly reconstructed ligament of the knee. There are countless graft options for ACL reconstruction. The two major groups, of course, are auto versus allograft, and common grafts in use are the bone patella tendon bone autograft or the quadriceps tendon autograft, as well as a hamstring tendon autograft, and then several allograft sources, including bone-to-bone allografts and bone tendon bone allografts and perineal allografts. It is widely accepted that 4-strand hamstring repairs represent a successful option for ACL reconstruction, and the popularity of this graft choice is increasing. Biomechanical studies have demonstrated that the strength of a tendon graft is directly related to its size. So therefore, the larger the tendon is that we harvest, the more likely it is to be able to be that we can quadruple it, and therefore the less likely it is to fail or rupture. We use the Arthrex system in our units, and this is an image of how we fold and reinforce the harvested graft from top left to bottom right. This is an example where we manage to quadruple a graft and then reinforce it with sutures. We then introduce the graft by preparing a femoral and tibial canal and pull the graft through the tibial canal into the femoral canal and lock everything in place with a tibial screw. Methods to investigate the question if the type of anesthesia influences the graft harvesting included a prospective non-randomized study. We gave the patients the choice of spinal versus general anesthetic, and after careful discussions of the pros and cons with an anesthetist, they decided which anesthesia they preferred. We then compared the grafts, the semitendinosus grafts that we harvested between these two groups. We enrolled 45 patients between August 2020 and January 2021. All operations took place in a single unit by the same surgeon to minimize any bias by the method of how the graft was harvested. As mentioned, the patients were given the choice between spinal or general anesthetic, and 31 chose general versus 14 in the spinal group. If general anesthesia was chosen, a short relaxation period was applied using rocuronium while harvesting the semitendinosus tendon, and this is where we hypothesized the main advantage of a general anesthetic might lie. This short time of muscle relaxation would significantly reduce the muscle tonus compared to spinal anesthesia, which still maintains a base level of muscle tonus. And therefore, in the relaxed muscle, we hypothesized that we'd be able to harvest a longer graft. The data for tendon length, folding factor, and diameter were collected as primary outcome, and demographic data was collected to correct for any biases. There were no significant differences in age, gender, sex, height, BMI, or weight between the two groups. However, on average, the semitendinosus that we harvested in the general anesthetic group was significantly longer than in the spinal group. We harvested on average 29 centimeters in the GA and only 25 centimeters in the spinal group. The length in itself, of course, is clinically not that significant unless it means that we can increase the folding of the graft. So we looked at how many grafts we managed to quadruple between the different groups, and again found a significant difference. 23 patients had quadruple grafts in the GA group versus 6 patients in the spinal group. The graft diameter we obtained through this was 8.5 in the GA and 7.7 in the spinal group. Again, highly significant results. So in conclusion, the general anesthetic with a short time relaxation while harvesting the semitendinosus tendon for ACL grafting allows to harvest a longer ST tendon and consequently yields better results regarding the graft dimensions. Therefore, based on these preliminary results, we recommend the use of general anesthetic as a standard practice if the patient does not have any significant contraindications for general anesthetic. Of course, one of the major limitations is the relatively small patient sample that we have. However, the study is ongoing to date, and we have by now doubled the patients in the GA group and tripled the patients in the spinal group, getting close to 100 patients combined, and the results remain highly significant as presented here. Many thanks for your attention, and I hope that you enjoy the rest of the presentation.